Full arch dental implants are a permanent solution for people who have lost an entire row of teeth, designed to restore function, preserve structure, and bring back confidence. Tooth loss rarely happens overnight. In most cases, it begins with gum disease or decay, slowly breaking down the teeth, inflaming the surrounding tissue, and gradually attacking the bone that supports them. Eventually, enough damage occurs that the teeth can no longer be saved. And even after the teeth are gone, the problem doesn't stop. The jawbone beneath continues to shrink over time. Traditional dentures simply rest on top of this problem. They replace the appearance of teeth, but they don't address what's happening underneath. Full arch dental implants work differently. Titanium implants are placed directly into the jawbone, replacing the natural tooth roots that were lost. A custom fixed bridge is then securely attached to those implants, restoring an entire arch of teeth as one stable, permanent foundation. It doesn't slip, it doesn't shift, and it doesn't come out. Before implants are placed, any remaining unhealthy teeth are carefully removed. This creates a clean, healthy foundation by eliminating damaged teeth, infection, and bacteria, giving the implants the best environment to heal and integrate. Over the next several months, the implants naturally fuse with the jawbone in a process called osseointegration. As healing progresses, the jawbone remains supported, bite strength returns, and the natural structure of the face is preserved. The result is a smile that looks natural, feels natural, and functions like natural teeth. You can brush them, care for them, smile with confidence, and enjoy the foods you love again. This isn't a temporary solution. It's not a removable appliance. It's a permanent foundation, restoring your smile from the inside out.